that again. What particular part of dentistry do you like?
From being an undergrad, Cormac and I went through two slightly different routes. I kind of was more interested in oral surgery, in the nitty-gritty part of work. I was very interested in sedation because my father was one of the first sedation dentists in the north of Ireland and taught it in Queen's University. So I naturally fell into that, and maybe I just wanted to do what my father did. My father did a lot of wisdom teeth, oral surgery and sedation, and I wanted to go down that route. And that coincided with, I suppose, with the advent and kind of maturation of implant therapy becoming a mainstream treatment. And I decided to go down that route, mainly kind of more oral surgery and sedation.
How many implants do you do?
A lot at this stage. I've been doing them since 1999. And the day you think, it's like anything in your profession, the day you think you've nailed it is the day you haven't nailed it.
Yeah.
You're always learning for those.
Yeah.
I mean, I'm qualified 22, 23 years now, and you'll still be learning into your 60s.
Has the technology changed in that time? The implant technology changed?
Yes, it has. I mean, technology has changed in terms of coating of implants, being able to load them more quickly, being more patient driven, so patients can come in, have their implants on the same day and have their teeth fitted. But the same principles of good surgical procedures apply from an orthopedic surgeon to a dental surgeon. When you're working in areas of the maxilla and mandible, they need to be treated with care, and those principles go back 100 years, you know.
Yeah.
So those principles haven't changed. But the technology has changed, and how we finally restore them has changed as well.
Conor, can you just explain I've this phrase "all on four" for
Mm-hmm.
people that wear dentures? Can you just how that actually works? Can you explain that?
It's a technique where patients have usually suffered from periodontal disease, less trauma, and they end up really on having to remove the remaining lower teeth. And typically, the solution after that is to have a full denture. A full denture is loose because you don't get the suction, and you have poor soft tissue control, and it becomes troublesome. Right. So you have the two options then of having an implant supported denture on all in four implants, and your denture is retained, screwed down onto the implant so it's fixed and non-removable. Yeah. There is the second option of having the overdenture with two implants. Now that is a removable overdenture, but it's a lot more stable because it's anchored by two implants.
Does that come out at night?
That comes out at night time.
Right, so it kind of clicks.
Kind of clicks in and clicks out. It just makes a lower denture a lot more stable. Overall, patients want something that is fixed and that is cleansable, and they don't have to worry about it.
And the procedure for that, if I was going to have that?
The most important part is planning any case, so that can take up to a couple of weeks to plan the case. And then you have the avenue that patients would like to go down now of having the teeth extracted and the implants placed on the same day, and with your immediate denture placed on the same day. So you walk in, have your teeth extracted, and have your implants and denture placed on the same day.
When you change somebody's smile or give them a different look or a different smile, and you can see the change, can you just tell me a little bit about that?
Seeing a patient come in from poorly motivated, have been through the system, nowhere else to turn, and being able to bring that patient through a whole sequence of events and get them out the other side after maybe 9 months. And I mean, that's hugely rewarding, functionally and cosmetically, and to see the life changes they have are incredible.
What makes Shield special?
I suppose the legacy is important to us. I suppose you still have to run everything as a business because you don't survive. It's still a vocation, and there's no doubt it's very rewarding. The joy about dentistry is that you get a fix. A patient has a problem. We're pretty simple guys. Patient has a problem, they come in, you're able to work on them. It's a manual thing, as well as a mental academic exercise, and at the end of the day there's a solution, and there's a fix at the end.
Just talk to me a little bit about sedation.
I've been sedating patients now for 22 years, and to this day, as my father still said as well, and my tutors used to say, it's amazing how you have a patient who comes in, and after infusing a drug, after a couple of minutes, how that patient is just transformed. Yeah. And how at the end of the procedure, how they change back to themselves again. And to have that, it's not a power thing, but to have that kind of that change in the patient, to be able to work with the patient and change their mindset and have them in this great relaxed environment. It's still kind of mind-boggling every time you do it. It's kind of going, wow, this is a wonderful technique.
What do you believe makes your practice stand out?
Cormac and I together in a partnership, and we have a multidisciplinary approach. We have certain strengths, and I concentrate on my strengths, Cormac concentrates on his strengths, and together then we can give the patient the best quality that they have.
Okay.
Can you explain to me what is the difference between a general dentist and a specialist orthodontist?
Okay, well, a general dentist would be comparable to a GP, so you're a general practitioner that you would go to with medical problems.
Yeah.
And for example, if you had a heart problem, they would refer you to a specialist, for example, a cardiologist, to perform heart surgery. You wouldn't expect your GP to perform the heart surgery on you. And similarly, if you need orthodontic treatment, you would go to a specialist orthodontist for difficult orthodontic problems.
Why did you particularly want to be a specialist orthodontist?
Well, basically because I like the visual results. They happen pretty quickly. So
Yeah.
I like the fact that I can actually change people's lives by improving their smile. Like in a lot of cases, people are very bothered about their teeth. They can be bullied, especially young children. The ideal age to actually bring a child to an orthodontist is from about 7 years of age, when their permanent teeth are beginning to erupt. Just to basically check how everything is erupting. Is
Yeah.
it normal? And if an interceptive treatment needs to be done early. In a lot of cases, nothing needs to be done, but it's no harm to reassure the patients and the parents of this. Sometimes if you do an early treatment, basically it negates a longer treatment later on.
I know that orthodontics is about straightening teeth,
It is, yeah,
but
absolutely.
it's about more than that, isn't it?
A lot of people think it's just a cosmetic thing, and that's not true. Basically, it improves your occlusion, which is your bite. It improves how your teeth fit together. Basically, it's more comfortable for a patient to have a better fit of the teeth. Adults might have lived with a problem for a long time and not realise that something could be done, and usually are amazed by the results. Sometimes like people think they're too old for treatment.
Yeah.
Like they're never too old. I've treated people in their 60s and 70s. I had clear braces myself, in fact, and
Did you?
I had them for months before some people noticed I had them, you know.
Really?
So yes.
With an adult, how long is the treatment plan?
If it's a straightforward case of aligning teeth,
Yeah.
it can be anything from maybe 1 year to a year and a half.
What aspect of your work gives you the most satisfaction?
Well, basically when a patient comes in with a very, very severe problem, for example, a child with an overjet, which is really prominent teeth, and I've treated many with overjets of 14, 15 millimeters, so that is pretty severe.
It's really,
Very prominent teeth.
Yeah.
You're bringing about basically a massive transformation for the patient, and kids are often bullied because of this, so it's really important for them psychologically as well.
what? Your grandfather,
Yeah,
your dad,
yeah,
your brother, your twin
yeah,
are all dentists.
yeah.
Is that why you were a dentist?
And I remember just saying to my father, I said, do you know what, I might do dentistry. And he said, you're not to do it just because of me. You're not to do it. And I said, I'm not doing it. He says, because it's hard work and, you know, it's a stressful job, but it's very enjoyable too. And I said to myself, do you know what, I might apply for it. So both Conor and I sort of pushed ourselves onto it. People do say to us, God, they find it strange and remarkable that you're twins and, you know, that you did dentistry together. To me, it was the most natural thing.
Yeah.
But maybe that's just being a twin.
Yeah.
So the first 1 or 2, 3 years are your hardest years,
Yeah.
very daunting. And then once you get over that, it takes a certain person to like dentistry.
When you got to about 27,
Yeah.
you must have been starting to sort of think, right, okay, I like that aspect of dentistry, or I don't like that aspect, or
Yeah.
what direction were you going in?
Well, I was doing a lot of sort of restorative dentistry. People arriving with sort of broken teeth.
Yeah.
And when I was 27 years old, I would individually think, right, I'm going to fix these teeth individually, you know,
Yeah.
which nowadays is probably the wrong thing to do because it's like building a house. So it was like what we call single tooth treatment. So I'd see one tooth broken and I would just fix that.
Yeah.
And then there'd be another tooth broken, I'd go, that's another job.
Yeah.
And at the age of 27, 28, I remember going, there's got to be more to this and that,
Yeah.
you know. And I went to the Eastman Dental Hospital, did quite a bit of restorative dentistry. So there you learned great old-fashioned dentistry, proper dentistry. Do you know what? I want to do things correctly and properly, because I watched my father being a dentist for a long time, and he never, you know, disrespected anyone. He said the patient was always the priority. I really enjoyed rebuilding patients' mouths from start to finish. So a lot of people were doing a lot of cosmetic work, and I was feeling, and the reason why I was feeling, it was because they didn't know how patients' bites work.
Yeah.
So if you were charging, or patients are paying a lot of money to get this type of work done, you've got to make sure it's predictable.
Yeah.
And so from there onwards, I stopped doing a little bit of dentistry and started thinking I've got to start working out how to do predictable dentistry. In dentistry, it's stressful enough to be doing the surgery, but that's the easy part. It's when patients are, you know, their treatment plans are expensive, you've got to make sure that you can predict your dentistry. And if something does go wrong, it's not a disaster. You can correct it because you know what's going wrong. The more satisfying cases where you've got a patient who comes in and really needs your help. They are phobic. I know I can help them, you know. I can't cure them overnight, but they've got to trust me. Once you get a patient who actually trusts you, you can do anything. You'll get them over that line. Conor and I work together in a way that we feel that when a patient walks in, that they're getting it's a cliche word, but the whole care. So in other words, you come in, you don't get a quick exam and just go, there you go, and this is what you're going to get, and if you like it, you know, tough, you know. Sit down with the patient, tell them exactly what do they want. Instead of us telling them what they need, what do they want? What are they worried about? Is there any issues, anxieties? My father would always say, you know, treat everyone as if it was your mother or your sister. Yeah. And if you're in the NHS, you'd like to do that, but unfortunately, you're not going to turn around to your mother and say, time is up, you know, we've got to go. So when those shackles are off, and you can treat people like as if it was your parents or your brother and sister, well, then immediately your standards go up really high, and you do care, because naturally you are caring, and then it all falls into place from there. The approach for our dental practice would be very different compared to the average most dental practices. The first experience when you arrive to this practice would be a very detailed examination, which would be 1 hour. Being two brothers, we have the advantage, and quite remarkable in the fact that we have both different interests in dentistry. Even though we're twins, he'd be highly trained in surgery. He's probably probably the best implant guy I've seen. He would be placing implants every day, and he would be doing oral surgery. He'd be doing sedation for nervous patients. So that's his skill set, and he is highly trained in that. My skill set would be more cosmetics, restorative dentistry, a lot of occlusion, how people's bites work, facial pain clinics, TMJ, dysfunction. So again, everything in the clinic is done under one roof. So in our team, it's not just the clinical directors, Conor and Cormac, regarding the implants and the other dentistry, is that we have a fantastic team of 2 specialist orthodontists who deal with children's orthodontics and especially adult orthodontics, and that is a huge factor for your patient's needs. Another very important skill set added to the practice recently is facial aesthetics. And again, not in our skill set, but the whole team approach. We are able to deal with people who want to improve their smile lines, their skin, their eyes. So it's a real team approach where everything is done under one roof. Probably the 2 most important people are the 2 hygienists we have in the practice, because we can't do any dentistry at all unless we've got the proper foundations, like building a house. So we can build all the houses we like. We've got to make sure that those foundations are in good order, they're maintained in good order throughout their life.
What's your ambition for the practice?
Well, my ambition, without being sort of over cocky, it really is that I know and I want this practice to be, you know, the best practice in Ireland and Munster, where people can walk in and go, wow, this is not just cosmetically a great looking practice. You walk in here and go, this team really care for me. This team really care for me, from the nurse to the hygienist to the associate to the orthodontist to the 2 principals. Everybody's working together to help you and to make sure that, you know, that your family and everybody's dental care is under good care, and that's what we want, to be a remarkable practice.
So the toothbrush, we always should go for the nice soft toothbrush, you know,
soft
so soft one, yeah. Because if you go for the hard brush, you might be scrubbing away your gums, that's what we don't want. We don't want to be causing recession. So nice soft toothbrush, very simple, something like that really, and when you brush your teeth, you just place the toothbrush at a 45-degree angle towards your gum. And then you just do small little gentle circular motion.
How much toothpaste do you put on?
Small, just a pea size really, so you don't want to be pea size, you don't want to be
Really?
wasting the toothpaste, and it's only as much as you can take. So pea size is plenty really, Yeah.
Okay.
Yeah, so these are little interdental brushes, so a lot of people would find them much better than a floss, they kind of don't like using the floss, or they're not able. So they are very, very good. So you just take one and put it in between your teeth and just go in and out a couple of times, between individual teeth. So yeah, they work really well. So
tell me about gum disease.
So gum disease is mainly bacterial kind of infection, bacterial disease. So it could be two different groups, so it's the mild kind of a version, which is the gingivitis, which is the early inflammation of the gums. So it's kind of, there is no destruction of your supporting tissues like the bone or the ligaments. So it's basically just the redness, inflammation, a lot of bleeding especially, so people kind of complain they have bleeding gums. So this kind of a gum disease, it's completely, resolvable. You can really get your gums healthy, by using the proper size brushes and brushing them really well, looking after them, using mouthwash and stuff like that. The second type of gum disease, which is the periodontal gum disease, periodontitis it's called, it's actually involving the bone. So the bone is kind of starting to resolve. So that's kind of unfortunate for the patient, it could be different stages of it. So we have kind of the mild, moderate and the kind of severe stages. And the mild one is kind of really just the bone levels wouldn't be as bad, So when you kind of measure the bone levels with a little probe, you can kind of assess the gums, you know how bad the gum disease is. So the treatment is kind of the same, but with the periodontitis, which is the second stage, you need kind of more treatment, kind of a more frequent treatment and root planing, as they call it, or root surface debridement.
I'm a dental hygienist here, so we're primarily involved with prevention of disease, dental disease, tooth decay, gum disease. So very often people come in, we treat any existing disease that they have, gum disease, or and then we create a personalised program for them, so it's specific to each individual. Then one may be high risk for tooth decay, one might be for gum issues, and then we put them on a maintenance plan. So when they come in, they're really seen as lifelong patients here, and they come in for maintenance, and it's all about prevention after that.
How long does it take to get a patient up to sort of a healthy sort of state?
It depends on the person, if I'm honest. Like one patient came in recently and they hadn't been in 10 years because they were nervous. And it might take a little bit longer for them, maybe 4 up to 6 sessions sometimes. Some, get away with murder and they come in and, it's every 6 months, it's fine. So it just depends on the patient needs, really. Gum disease, the biggest reason we lose teeth in Ireland is untreated gum disease.
Is it?
Untreated, and very often people don't have any pain, or not until it's like the 11th hour and you're in trouble. So it's a regular screening when they come in will help to detect when you come in for regular examinations. So, and basically we'll get it at the early stages that way.
Do most people sort of clean their teeth properly?
Most people don't floss. I'm going to be honest about it.
Don't floss?
No.
Right.
So,
floss is a new thing though, isn't it? Flossing. I mean, that's an American type thing, isn't it?
Well, that's what a lot of people say till they come in and then they see what they're missing really. When we go through the program, we'll say, okay, now this is it, because plaque is invisible. You don't see it, it's creamy coloured. So a lot of people say, oh, maybe when I get food stuck, I'll use a bit of floss, or, but actually what you don't see is most valuable to remove.